Hello, I'm Dr. Victoria Palmer, and today I'll be speaking about the potential use of curcumin, garlic, and zinc in papular urticaria from an immunological perspective. The authors are Dr. Edwards and I, and we both completed our medical training at the University of the West Indies, Jamaica, and pursued a clinical dermatology degree at Cardiff University in Wales, where we both matriculated with distinction. I currently work as a PGY1 resident at Richmond University Medical Center in Staten Island, New York, and Dr. Edwards works as a PGY1 resident at SUNY Downstate. So papular urticaria is a papulovesicular hypersensitivity reaction to arthropod bites, and this condition most commonly affects children. Patients with papular urticaria predominantly respond to insect bites with increased CD4 positive T helper 2 cell cytokine production compared to healthy controls. Additionally, patients with this condition have less regulatory cytokines such as interleukin 10, and there is large crossover and overlap with other atopic conditions. The management of papular urticaria has traditionally been guided by the treatment of itch and inflammation with medications such as oral antihistamines and topical corticosteroids, along with the removal of the offending agent. This review aims to establish the theoretical role of zinc, garlic, and curcumin in the immunomodulation of the pathogenesis of papular urticaria. We established our findings by performing a comprehensive review of the literature using irrelevant keywords, during which we discovered that while there are many studies involving the use of complementary and alternative medicine in itch, no complementary and alternative medicine studies specifically targeted towards papular urticaria were encountered. 11 studies were extracted discussing the immunomodulatory effects of zinc, garlic, and curcumin, and their mechanisms of action were compared to the overlapping pathogenesis of papular urticaria. During our research, we found that there were 5 stages of evolution after repeated exposure to insect bites. Namely, the first stage was a minimal reaction, and this correlates with a period of sensitization during infancy. Stage 2 is associated with a delayed type hypersensitivity reaction, which correlates to a type 4 response. Stage 3 is associated with an immediate hypersensitivity response, and clinically this is envisioned as an urticarial papule followed by a delayed reaction. Stage 4 is associated with an immediate reaction only, and stage 5 was associated with no reaction. The delayed type hypersensitivity stage and immediate hypersensitivity stage of the pathogenesis have propensities for a T helper 1 cell profile and T helper 2 cell profile, respectively. And the elapsed time between an insect bite and the eruption of a parasitic papule lengthens as children gain continued exposure to the antigens, in keeping with the stage 3 response. More specifically, aged garlic extract and supplemental garlic oil have an effect on the Th1 and Th2 cell balance. An enhanced T cell response towards the Th1 type is observed at low doses, around 50 milligrams per kilograms, and towards the Th2 type at high doses, around 200 milligrams per kilograms in murine studies. Curcumin was associated with an irreversible suppression of interleukin 2 production and cytotoxic T lymphocyte development at 12.5 to 30 macromoles per liters, with the effect of the latter being greater. Additionally, there was an inhibition of interleukin 12 production in macrophages in a dose-dependent manner, leading to the inhibition of Th1 cytokine profile. That is, there was a shift towards the Th2 cytokine profile, and this could potentially contribute to a stage 3 immediate hypersensitivity reaction of papular urticaria sensitization. With zinc, there was conflicting evidence as to whether or not there was a shift in the Th1 or Th2 direction, with studies suggesting that deficiency or increased concentration of zinc can result in a shift towards the Th2 effect. So, in conclusion, there's a multimodal management required for papular urticaria, with therapies directed towards reduction of pruritus and mitigating immunological cascade. Garlic has a dual effect, with an enhanced T cell response towards the Th1 subtype observed at low doses and towards the Th2 subtype at high doses. Studies suggest that curcumin shifts the immune system's balance towards a Th2 cytokine profile, which could potentially contribute to the immediate hypersensitivity stage of papular urticaria sensitization. And the effects of zinc on the Th1 and Th2 profile is still controversial, with some studies suggesting that high concentrations may precipitate a Th2 response, while others demonstrate this outcome in zinc deficiency. So, a key takeaway from this study is that the administration of these supplements could potentially be individually dosed according to the sensitization stage of a person's papular urticaria to aid in immunomodulation and mitigation of the underlying cytokinetic profile. There were some study limitations which we would like to outline, which is that this is a theoretical application of data. There have not really been any clinical studies outlining the use of these agents in papular urticaria, and these are all extracted from other studies. And this limits our recommendations on safe dosing as well as proper routes of administration. So these are our references, and this is our contact information. Thank you so much for listening today.